Dr. Schwartz has extensive plans for Barb's smile makeover.
So when I'm looking at your smile, I'm not looking at just your teeth, I'm looking at your whole face. And your face is going to dictate how I go ahead to restore your smile. Okay? Okay, Barbara, I want you to give me a big smile. This is actually your mouth. We took impressions of you at your first visit to see where our bite is. There's that tooth that's kicked back on you. Mm-hmm. And our concern too is when we close down, it's that the midline is not correct when we look at the midline compared to the top and the bottom. It's off. There's a discrepancy between the midline of the bottom teeth and the top teeth. And we want to align that when we're looking for perfection in the smile. So in a case like this, veneers are not really an option at this point. We need to straighten the teeth. And by digital animation, look what we're able to do. I think because of the amount of misalignment that you have is not that extreme, that I think we're going to get a much better result overall, more bang for what we're doing by going ahead and doing veneers. In your case, we'll be doing 10 veneers on top and 10 veneers on the bottom, as well as replacing the older gold crowns, which you have, which is 5, with all ceramic crowns. This is what we've proposed so far. Mike did the wax up on this of what your smile will potentially look like when we are done. These teeth are going to look perfectly straight. And we don't want people to ask, who is your dentist? We want them to ask, who are your parents? And that this is just genetics and you just have great teeth.
Please be advised the following segment contains graphic images. Dr. Tamir Mosharrafa explains his plan for Barb's body makeover.
So we're just going to start by taking a look at your face, and we're going to sort of start at the top and work our way down. One of the first things that we think about when we're going to be doing eyelid surgery or eyebrow surgery is, where is your hairline? Because that can be a factor in terms of where we want to put these incisions.
Good morning.
How you feeling today?
Doing good.
Good? You nervous?
No.
No? Good. Good. Glad to hear that. But again, in your case, your hairline is what I would call a medium height. And so we don't have to be too concerned about moving the hairline back. We've talked about your eyes, and one of the things I'd like to point out to you about your eyes is that you do tend to carry a bit of your age in your eyes. Now, you have a very youthful and very pretty face, and you don't show a lot of age, but one of the areas where you do show a little bit of age is in your eyes, and you have a fairly heavy brow, and you have a fair amount of redundancy in the upper eyelids. But what I want to show you is, if I just take and just elevate your brow just a little bit and get your brow up where it belongs. The first thing we're going to do is we're going to put your brow back where it belongs with a brow lift. And we mark this about 8 millimeters above the lashes here, because we want this incision to fall right within that crease. So when you open your eyes, you won't be able to see that scar. Good. And open for me. Good. Good, and they completely disappear when you open. The level of the brow should be above the bony rim of the orbit. And you can see in your brows are well below the bony rim, particularly in the inner part of the brow, which gives your brow almost a little bit of a sinister appearance to it. What we're going to do is we're going to put the brow back where it belongs, up above that bony rim. Now, we don't want to overdo it because we don't want to give, exactly, that deer in the headlights look. We want to avoid that. But we just want to put it in a nice pretty position here, back where it was when you were in your 20s. And then that'll allow us to do a little bit less aggressive work on the skin of the eyelid. We won't have to take quite as much skin from the eyelid once we get the brow in the proper position. We can make just little stab incisions in the hairline that won't show, and we can suspend the brow that way using a little camera. Now with the lower eyelids are tricky because with the lower lids, a lot of the problem with the lids has to do with the position of the fat within the eyelid. And what you see here is you see that fat is a little bit prominent here, and we'd like to smooth that junction between the lower eyelid and the cheek. Slide your waistband down a bit so we can take a look at it.
3 surgeries, 2 C-sections.
Okay, so 2 C-sections and a hysterectomy.
Right.
Gotcha.
I've had
Everything you need in
surgery
it.
on my stomach before for babies and hysterectomy. And I'm pretty tough.
Just going to press here a little bit. Does that hurt at all when I push in those areas? As I was saying, the other effect of the local anesthetic is to constrict the blood vessels so you get less bleeding. Most women who've had 2 or more pregnancies will have some separation of the muscles in the abdomen, which need to be tightened a bit. And you have a little bit of that, not much.
Okay, I'll take a 15 blade.
There's sort of 2 components to the tummy tuck. There's the skin, getting rid of the extra skin, but also there's the deeper layer, the muscular layer that we're going to tighten up. That helps bring the waistline in and helps also get rid of some of the prominence of the abdomen and give you a much flatter tummy when it's all done. Yeah, in fact, walking is very important. I'm going to have you walking about 4 hours after you wake up from the anesthetic. Walking is very, very good because it keeps your muscles contracting in your legs and keeps you from forming blood clots. Help take care
Well,
of
they
it.
cut through muscles to do C-section, right?
They do. And
I mean, it's the same muscles? Or?
Yes, in fact it is. The incision that goes across here, though, actually cuts through more muscles, and I'm not going to be cutting any muscles. I'm going to be tightening muscles and moving muscles and bringing them back together, but I won't actually be cutting through any muscles. So in that regard, it may be even less pain than having a C-section. So, along with bringing up the brow, putting it in position, we also will address these muscles and get rid of some of those scowling muscles to soften that area and the frown lines, and hopefully keep you from developing any deeper creases in that area.
You see the lid cheek junction here sits about here, which is youthful. Over here, it's way down here, which is more aged. And again, a nice smooth contour here compared with this puffiness and this excess here that makes you look tired, makes you look a little bit older.
Next week, Barb's husband Steve talks about his wife's makeover. Meanwhile, Lisa visits the med spa to learn what skin treatments would help her turn the clock back on aging. Then, it's Lisa's 6-hour surgery for eyes, tummy, and breast enhancement. Lisa Ellis and Barb Hoffman have been selected for a once-in-a-lifetime opportunity to receive their dream makeover. Like clay in the hands of a sculptor, they entrust themselves to the outstanding talents of the beauty team. Please visit thebeautyshow.com, where you can read Barb and Lisa's weekly updates to get more details about what they're going through. On our website, you can also learn more about the beauty team's experience, qualifications, and contact information. Don't forget to join us next Tuesday to watch Lisa and Barb continue their makeover journeys. Have a great week.